The death of an Indigenous inmate at a private jail in New South Wales has exposed gaps in healthcare inside the prison system. A coronial inquest into the 2020 death of Reuben Button at the Junee Correctional Centre found his healthcare was compromised by a lack of timely access to specialists and Aboriginal health workers. Emily Doak has more.
Kamilaroi woman Amber Brown grieves for her brother Reuben Button, who was just months away from release when he died in his cell.
Reuben was so funny and such a humble person. You know, he was 6'9", weighed 162 kilo, I think it was. So he was just such a gentle giant.
The 34-year-old died of heart disease. He also had hypertension, diabetes and obesity. His weight had almost doubled in the 5 years he was in jail. New South Wales Deputy State Coroner Harriet Graham found it was obvious that he needed significant health support and recommended increase to doctors, nurses and Aboriginal health workers. Amber Brown's calling for more culturally appropriate care for inmates in both private and public jails.
At the end of the day, nobody can talk to an Aboriginal person better than an Aboriginal person. And we understand each other and understand the needs of our people from a cultural perspective. Your walls are already broken down. And I guess for inmates, there's lots of trauma and trust issues and stuff like that. You know, Aboriginal people mean it when they say, "Hey sis, how you going?" or, you know, "Are you right today?" And that's what pulls down these barriers.
The Junee Jail's private operator, the GEO Group, says it now has 2 Aboriginal liaison officers and an Aboriginal health nurse, and that wait times for medical appointments have decreased. But New South Wales Greens MP Sue Higginson says privatisation of prisons is failing inmates, and she wants a parliamentary inquiry.
This is a real problem, and it's the problem of the state. We need to ensure that not only are all inmates able to access the same quality of healthcare, that care is of the highest standard, particularly when we're looking at mental health, because we know that it's mental health that leads to suicides or deaths in custody. We've got a real problem within our correction system right now. The evidence is clear. The coroner has identified one of the elements of that problem. We must do better.
CEO of the advocacy group National Justice Project, George Newhouse, says gaps in healthcare for inmates are reflected in prisons across the country.
It's not limited to New South Wales. In fact, it's worse in many other states and territories. I think Western Australia and the Northern Territory are some of the worst imprisonment and confinement conditions in our nation. Aboriginal prisoners and also culturally and linguistically diverse prisoners require culturally safe care.
He believes healthcare in jail should be provided independently.
When you are a captive of the prison system, like a medical service that's provided by the Department of Justice, the people that pay you decide what level of healthcare you get. The focus isn't on the patient. And prisons and detention centres don't want independent people actually advocating for the prisoner.
Amber Brown hopes her brother's death will lead to change.
The ultimate goal is that there's no deaths in custody. There needs to be a care factor in there to make sure that everybody's looked after.
That's Kamilaroi woman Amber Brown ending that report from Emily Doak. And the New South Wales Minister for Corrections, Analak Chanthavong, says delivering better outcomes for inmates is something that the state government takes seriously, and that the Junee Jail's progress in implementing the coroner's recommendations will be reported in the next 6 months. Finally today, a former